Hello, I'm Dr. Paul Charlson. I've got clinics in London and Yorkshire. I'm going to talk to you today about weight loss drugs. There's lots of talk out there about weight loss drugs. Are they safe? Are they dangerous? What do they do? Etc. etc. So the drugs that we use in clinic are drugs which mimic natural hormones, and those hormones control your hunger and your blood sugar control. So by using these drugs, you can effectively manipulate your brain to think that you're not hungry, and also to smooth out your blood sugar control. And both those things allow you to eat a more calorie controlled diet quite easily. This with smaller portions, you just don't feel hungry, and this leads to a weight loss, which is generally good for your health. The thing is about these drugs is, as far as we know, and of course they're still relatively early days, these drugs are safe, and the benefits certainly outweigh the disadvantages. And side effects we tend to get are around nausea and vomiting and some diarrhea, but generally they're pretty well tolerated in a controlled medical environment. The problem is that many people are getting these on the internet. They don't know what they're getting, and even if they are getting the genuine drug from a pharmacy, there's no medical person actually overseeing what they're doing, what their dosing is, and really making sure that they're using them properly. They are pretty easy to use, but it's quite easy to not use the pens properly. And also there are other aspects and things that come on around dosing and that, which do require some medical supervision. So my feeling about these drugs is many people will benefit from these drugs. They generally look to be safe. They look as if they've got quite a lot of advantages, but they do need to be used properly. They are prescription drugs and should be obtained via a prescription, and really should be seen by a medical person who writes the prescription in the first place. That's the safe way to use these drugs and the most effective way. So if you're interested in discussing this, please do get in touch. Thank you very much indeed.